What if I told you that a single small daily habit, something so simple it costs nothing and takes less than 5 minutes, could quietly protect you from up to 90% of the diseases most Americans fear the most? I know, that sounds almost too good to be true. But here's what Dr. Leonard Brooks, who spent over 3 decades studying preventive medicine and aging, kept telling his patients, and what the research is now confirming louder than ever. Your health is not determined by your genetics alone. It's shaped every single day by the choices you make before breakfast. If you're over 60, chances are you've been told what to stop doing. Stop eating this, avoid that. Take these pills, watch these numbers, but nobody sits down with you and says, here are 6 things you can start doing today that could restore your memory, reduce your cancer risk, clean out your arteries, and bring your energy back. That's exactly what we're doing right now. These aren't miracle cures or expensive supplements. They're 6 habits so simple that most people walk right past them. But done consistently, they activate some of the most powerful healing responses your body already has, built right in, just waiting to be switched on. So if you've been watching your energy slowly drain year after year, wondering if this is just what getting older feels like, stay with me. Because Dr. Leonard Brooks would tell you, it doesn't have to be this way. Let's get started. Habit 1. Morning hydration. The first habit is so simple, so embarrassingly ordinary, that most people dismiss it without a second thought. Drink a full glass of water the moment you wake up, before the coffee, before the news, before you even check your phone. Now I know what you might be thinking. That's it? Water? But here's what Dr. Leonard Brooks explained to his patients for years, and what most people over 60 don't realize. By the time you open your eyes in the morning, your body has gone 6 to 8 hours without a single drop of water. That's nearly a third of your entire day spent in a state of slow, quiet dehydration. And for your heart, your brain, your joints, that matters more than most doctors take the time to explain. When you wake up dehydrated, even mildly, your blood becomes thicker and harder to pump. Your heart works overtime. Less oxygen reaches your brain, leaving you foggy, forgetful, and slower than you should be. And your body's natural detox systems, your liver, your kidneys, can't flush out the waste they collected overnight. Here's the part that surprises most people. Chronic, low-level dehydration has been linked in studies to increased risk of kidney stones, urinary tract infections, and even certain cancers, including bladder and colorectal cancer. Not because water is magic, but because a dehydrated body is a body that can't clean itself properly. Now flip that picture. Start your morning with 1 or 2 glasses of clean water and you immediately do 3 things. You kickstart your metabolism, you thin your blood, taking pressure off your heart, and you activate the systems your body uses to clear out what doesn't belong. For people dealing with stiff joints or that heavy, slow feeling in the morning, this single habit can make getting out of bed feel noticeably different within days. Some people add a squeeze of lemon or a small pinch of sea salt for electrolytes. That's a nice bonus, but plain water works just fine. What matters isn't the recipe. What matters is the consistency. Dr. Leonard Brooks used to share a story about one of his patients, a man named Robert, 79 years old, who came in concerned about his blood pressure creeping up. Dr. Brooks didn't immediately reach for the prescription pad. Instead, he asked Robert one question. "What's the first thing you do when you wake up in the morning?" Robert thought about it and said, "I make coffee." Dr. Brooks smiled and said, "Let's try something first. Before the coffee, just 1 tall glass of water, every single morning. Give me 90 days. Robert thought it was too simple to matter, but 90 days later, his blood pressure had come down, his energy had improved, and for the first time in years, he said his mind felt clearer before noon. He laughed and told Dr. Brooks, "Doc, turns out I wasn't getting old, I was just dry." Sometimes the most powerful solution is the one we overlook because it seems too easy. So before you reach for another supplement or schedule another appointment, ask yourself honestly, did you give your body what it needed first this morning? 1 glass of water? Every morning. It's not complicated, but done daily, it is absolutely powerful. Habit 2. daily brisk walking. The second habit that could help 90% of the diseases we fear most quietly disappear? Brisk walking. Every single day, not running, not hitting the gym at 5 a.m., not anything that requires a membership or special equipment, just walking with intention and a little pace for 15 to 30 minutes a day. And yet, Dr. Leonard Brooks called this the most underrated prescription in all of medicine. Here's why. When you walk briskly, you're not just moving your legs, you're pumping blood through every major system in your body. Your heart rate rises, oxygen delivery improves, your muscles pull sugar out of your bloodstream, which is one of the most powerful natural ways to lower your risk of type 2 diabetes. But the benefit that surprises people most is what brisk walking does for the brain. Studies have shown that older adults who walk regularly have measurably more volume in the hippocampus, the region of the brain most responsible for memory. We're talking about remembering names, appointments, where you put your keys. When blood flows freely to the brain, your neurons stay nourished, oxygenated, and active. And cancer? While walking doesn't cure cancer, consistent physical activity has been shown to lower the risk of colon, breast, and endometrial cancer. It regulates hormones, reduces chronic inflammation, the environment where cancer quietly thrives, and strengthens what scientists call immune surveillance, your body's ability to detect and destroy rogue cells before they become a real problem. The key word here is intentional. A slow stroll through the grocery store doesn't count. You need to move with some purpose. Swing your arms a little. Pick up the pace enough that you're slightly out of breath, but could still hold a conversation. Go outside if you can. Sunlight and fresh air add their own layer of benefit. But indoors works too. The habit matters more than the location. Dr. Leonard Brooks had a patient, a woman named Dorothy, 74 years old, who came in with high cholesterol and what she described as a fog that had been sitting over her mind for 2 years. She'd tried crossword puzzles, she'd tried brain games, nothing was cutting through. Dr. Brooks gave her one instruction: walk briskly for 20 minutes every morning, 6 days a week. That's it. 3 months later, Dorothy came back to the office. Her cholesterol numbers had improved. But more than that, she said the fog had lifted. She was sleeping better. She'd gone back to reading novels, something she hadn't enjoyed in years, because she couldn't focus long enough to follow the story. "Doc," she told him, "I thought I needed a pill. Turns out I needed a sidewalk." There's also something deeply psychological about walking daily. In a season of life where so many things feel like they're being taken away, mobility, independence, energy, choosing to walk every day gives something back. A quiet kind of power, a decision you make for yourself. If you're still watching and finding this valuable, drop the number 2 in the comments so I know you're here. And if you haven't already, hit that subscribe button and the bell so you never miss what's coming next. Now, let's keep going. Habit 3. Deep breathing and conscious stillness. Of all 6 habits, this one might surprise you the most. It's not a supplement. It's not an exercise. It doesn't require you to leave your chair. It's deep breathing, combined with a few minutes of conscious stillness, practiced every single day. Dr. Leonard Brooks used to tell his patients, the most dangerous thing happening to your body right now might not be what you're eating. It might be what you're quietly carrying. Here's the science behind why this matters so much. When you take slow, controlled breaths, deep into the diaphragm, not shallow into the chest, you activate what's called the parasympathetic nervous system. Most people know it as the rest and repair mode. When this system is engaged, cortisol levels drop, your heart rate slows, and inflammation, the root driver behind cancer, dementia, arthritis, and heart disease, begins to calm. The problem is that most Americans over 60 are walking around in a constant state of low-level stress. It doesn't always feel dramatic. It's the quiet worry about finances, about a diagnosis, about children or grandchildren, about being a burden. That stress accumulates silently, and it shows up in the body, in the blood vessels, in the immune system, in the brain's memory centers. Deep breathing interrupts that cycle. Just 5 to 10 minutes a day, sitting quietly, slowing your breath down. Inhale for 4 counts, hold for 4, exhale for 4. That simple rhythm can literally reset your body's stress response, and over time, it reduces your cardiovascular risk, lowers systemic inflammation, and supports sharper thinking. Add mindfulness to that, not complicated meditation, just the practice of noticing your thoughts without judging them. And you give your brain what Dr. Brooks called a mental shower, clearing out the static that builds up when we never pause. For older Americans, especially those living alone or managing a lot, this habit can be transformative, because sitting quietly and breathing deeply isn't doing nothing. It's sending a message to every cell in your body. You are safe. You can heal now. If you've never tried this, don't worry about doing it perfectly. Sit comfortably, breathe slowly, be kind with yourself. Let your mind wander if it needs to. Let your body settle. You may be surprised what shifts, not just in how you feel in that moment, but across days and weeks. Less tension, sharper clarity, more energy that lasts. This habit, practiced consistently, may be the foundation that allows every other habit to work better. Habit 4. Cold water exposure. This next one might sound a little extreme at first, but stay with me because the science here is genuinely fascinating and the practice is far more accessible than you'd think. Cold water exposure. Now, before you picture ice baths or polar plunges, that's not what we're talking about. Dr. Leonard Brooks was practical with his patients. He wasn't about dramatic gestures. He was about sustainable habits that work. What he recommended was this: finish your daily shower with 30 to 60 seconds of cool water, or splash cold water on your face and arms before breakfast. That's it. That's the starting point. Here's what happens in your body when you do this. The moment cool water touches your skin, your blood vessels contract, then rapidly dilate, a kind of cardiovascular workout that improves circulation throughout your entire system. Your heart rate slows, and your body releases a burst of norepinephrine, a natural chemical that reduces inflammation, sharpens mental clarity, and elevates mood. In short, a brief cold rinse wakes up your body and signals it to operate more efficiently. Dr. Brooks had a patient, a woman named Margaret, 73 years old, who had been dealing with persistent joint pain and what she described as a morning fog that took half the day to shake off. Her grandson had told her about cold showers. She laughed at the idea at first. "That's for athletes," she said, not for a 73-year-old grandmother in Ohio. But eventually she tried it. Just 30 seconds of cool water at the end of her morning shower. Within 2 weeks, she told Dr. Brooks she was waking up sharper, her knees felt less stiff, and, perhaps most surprisingly, her mood had lifted noticeably. "It's like a jolt," she said, "but a kind one, like my body remembered it was still alive." That's exactly what cold exposure does. It pulls the body out of the slow drift that aging can bring. It reactivates systems that have grown sluggish. For older adults, that kind of stimulation isn't a shock, it's a gift. There's also growing evidence that regular cold exposure increases something called brown adipose tissue, a healthy type of fat that burns energy and helps regulate blood sugar and body temperature. For people watching their glucose levels or concerned about weight, that's a meaningful bonus. Start with curiosity, not pressure. Try it 1 week. Notice what shifts in your energy, your joints, your mood. Your circulation improves. Your immune system strengthens. Sometimes the road back to vitality isn't more medication or more effort. It's reintroducing your body to its natural rhythms. Cold water reconnects you to those rhythms. If you're still with me, drop the number 4 in the comments. And if this content has been valuable to you, please subscribe. It genuinely helps us keep doing this. Habit 5. Consistent sleep and wake schedule. Most Americans over 60 have accepted poor sleep as an inevitable part of aging, something to manage, not solve. But Dr. Leonard Brooks would push back on that every single time. He'd sit across from a patient complaining of fatigue, brain fog, or worsening memory. And before he ordered a single test, he'd ask, "What time did you go to bed last night? And the night before? And the night before that?" 9 times out of 10, there was no consistent answer. And that, he would explain, is a much bigger problem than most people realize. Here's the science. Your body runs on what's called a circadian rhythm, an internal 24-hour clock that governs when you feel alert, when your organs perform at their best, when your immune system is most active, and when your brain does its most important repair work. When that clock is disrupted by irregular bedtimes, late-night television, random naps throughout the day, or simply waking at different hours every morning, everything suffers. Blood sugar regulation becomes less precise. Memory consolidation is interrupted. Inflammation rises. The immune system loses its timing. But here's the beautiful thing. You don't need a pill to fix this. You need a schedule. Going to bed at the same time and waking at the same time every day, yes, including weekends, is one of the most powerful things you can do for long-term health. When your body knows what to expect, it can prepare. It releases the right hormones at the right moments. It repairs tissue more efficiently during deep sleep. It keeps inflammation in check. Dr. Brooks had a patient, a retired schoolteacher named Frances, 76 years old, who had struggled with restless nights and foggy mornings for nearly a decade. She'd tried teas, melatonin supplements, warm baths. Some things helped temporarily, but nothing held. Her granddaughter, who was studying health sciences, suggested something deceptively simple: pick a bedtime and a wake time and protect them like appointments, no matter what. Frances was skeptical, but she tried it. 3 weeks in, she started waking up naturally, before her alarm. Her energy returned. Her arthritis flares became less frequent and less severe, and her mind, she said, felt present in a way it hadn't been in years. Here's why that happened. During consistent, deep sleep, the brain's glymphatic system, its built-in cleaning crew, activates fully. This system flushes out waste proteins that, when left to accumulate, are directly linked to conditions like Alzheimer's disease. It only does this job properly during deep, uninterrupted sleep. And a regular sleep schedule is what makes reaching that deep stage reliably possible. Hormones like melatonin and cortisol also regulate more effectively. Melatonin helps you fall asleep naturally. Cortisol supports alertness, immune balance, and energy during the day. When your schedule is consistent, these hormones work with you instead of against you. Pick your time tonight, protect it tomorrow, and trust that your body, given the right rhythm, knows exactly how to heal. Habit 6. Daily sunlight exposure. The sixth habit is one Dr. Leonard Brooks called the most freely available medicine in the world and the most consistently avoided. Daily sunlight exposure, not tanning, not burning. Just 15 to 20 minutes of natural sunlight, ideally in the morning, on your face, arms, and hands. Here's what that does inside your body. Sunlight triggers the production of vitamin D, which is not just a vitamin but acts more like a hormone, regulating immune function, bone strength, mood, and even cancer protective mechanisms. Studies have linked low vitamin D levels, extremely common in older Americans, to increased risk of depression, cognitive decline, osteoporosis, and several forms of cancer. But the benefits go beyond vitamin D. Morning sunlight helps set your circadian rhythm, reinforcing that sleep schedule we just talked about. It signals your brain that the day has begun, suppressing melatonin and elevating serotonin, which improves mood, focus, and energy throughout the day. Dr. Brooks had a patient named Earl, 80 years old, a retired factory worker from Michigan, who spent most of his winters indoors. He came in every February like clockwork, low energy, low mood, achy joints, and what he called a kind of gray feeling. Dr. Brooks prescribed no new medications. Instead, he told Earl, every morning after breakfast, even in winter, put on your coat and sit on your porch for 15 minutes, face toward the sky. Earl thought it was the strangest advice a doctor had ever given him. By March, he said it was the best. His mood had lifted. His energy had returned earlier in the day. He was sleeping better at night, and his vitamin D levels, checked 3 months later, had risen meaningfully without a single supplement. The habit is simple. Step outside in the morning. Let the light reach your eyes and skin. Don't stare at the sun. Just be in it. Let your body remember what it's designed to receive. If you're already doing this, wonderful. If not, this is one of the easiest habits to start tomorrow morning. If you've made it this far, you're exactly the kind of person Dr. Leonard Brooks loved having in his practice. Not someone waiting to be told what's wrong, someone actively asking what they can do. We've walked through 6 habits today, and while each one might seem simple on its own, together they form something powerful, a daily framework that can reshape the second half of your life, not by chasing youth, but by honoring the body you have right now, today. Dr. Brooks used to close every appointment with the same words. Your body is not finished with you. Don't be finished with it. You are not too old to change. You are not too far gone to feel better. The science is clear, and more importantly, the stories of real people who made these small shifts and found their way back to energy, clarity, and joy, those stories are real. The question isn't whether change is possible. The question is whether you'll give yourself permission to try. You don't need to be perfect. You just need to be willing. Willing to listen to your body. Willing to be a little gentler with yourself. Willing to start, even imperfectly, today. That's where real transformation begins. Thank you for spending this time with us. We'd love to hear from you. Drop a comment below and share one habit you're committing to starting this week. Your words encourage not just us, but everyone else in this community who's on the same journey. If this video brought you value, please give it a like, share it with someone you care about, and subscribe so you never miss what's coming next. Dr. Leonard Brooks believed that the best years of your life don't have to be behind you. We believe that too. See you in the next one.